Hey, short video on some of the products we have in stock for you to help with some of your summer woes, from itchy skin with bug bites or poison ivy to blemish prone skin if you are wearing SPF and out in the sun and sweating, to even dry skin if you're having to wash your face a lot because of those things, as well as some other products that people are coming in for sleep as they're up late or up early, and we've got lots of lovely sunlight in Minnesota now, and we're all going to enjoy it because that doesn't last long here. Bite Balm has been hugely popular, and this is just a seasonal product from Ananda. It's a roll-on and works really excellently on bug bites or any sort of kind of rashy, itchy skin. Some essential oils help with the itch. The full spectrum extract in here helps with inflammation, which helps with itch. We have several left in stock, but they're like a one-time order. So if you have it and you love it and you are running low, I would come in and get more because it will be gone. For blemish prone skin, there's Advanced Spot Serum. I've gotten pretty good feedback on this, and you can use it as a spot serum or an all-over serum. It's not drying. It's not like a harsh treatment for blemish prone skin. And you know what I find with a lot of people with blemish prone skin, they're thinking, I've got to scrub all the oil out of my face, I've got to exfoliate, and they're being really harsh on their skin. A lot of times blemish prone skin is actually a bit sensitive. And so we are constantly putting harsh chemicals on and scrubbing really hard and doing this several times a day. And a lot of that, the blemish problem is also inflammation. And it's also, if you're removing all of your oils, then your body is just thinking, I've got to produce more oil, and you're compounding the problem. So the blemish prone skin spot serum is nice because it's balancing, and it's got some extra ingredients such as tea tree and neem in it, but also the extract that is very anti-inflammatory. And there are some nice studies on CBD and hemp extract in acne-prone skin and helping with sebum production and inflammation. So it's a nice product, a nice option, and I've gotten good feedback. By far the fave is the Hydrating Glow Serum. It's a very light serum but very nourishing, so it's not too much for the summer months when you might need a little bit less on the moisturizer. But it does have a nice glow and really adds to your skin. This has been very popular here. Because we've had a lot of requests for CBD gummies, we carry Ananda because when we look at companies to go with, they are the most forward-thinking in terms of CBD research and having medical staff on board and being involved in advocacy and education and support for us, which we like very much. But they don't make gummies. So we got a couple of gummies from Charlotte's Web, also a very good company, third-party tested. A lot of pharmacies carry Charlotte's Web, and so we have sleep gummies. And some people just prefer gummies, and they'll come in and say, well, I used a gummy, or I used a gel cap, or I used a tincture, and do I need that? CBD is CBD. It's from the same plant, it's the same compound, should be the same compound, it's the same extract. And so when you're choosing a gummy, a tincture under the tongue, a gel cap, you are choosing a delivery system that is convenient for you and that works for you, that you like to use. When you put a tincture under the tongue, so this is probably our most popular tincture, the 600 milligram bottle, and it's the only one Ananda has flavored, vanilla orange, and that's been popular with people. It's not overpowering, but just enough. But when you put a tincture under your tongue, you're not just swallowing it into your digestive tract. You're absorbing it through the membranes under your tongue, so it does get into your bloodstream a bit faster. CBD is an oil, so it's pretty well absorbed in your GI tract. It doesn't take tons of time for your body to break down that capsule, but it'll be a bit faster if you're putting it under your tongue. The big bonus with a tincture versus a gel cap is now you're not losing any dose. You're not wasting any. When you swallow that gel cap, some of your dose is just gone forever. Your body's not using it. And that happens with a lot of things that go through your digestive system. So the tincture is very nice because it's easier on your wallet more than anything. But a lot of people don't want to have something under their tongue for 2 or 3 minutes, and I get it. It's inconvenient if you're traveling, if you just want to pop something in your bag and bring it with you. We have gel caps, and I always suggest to people, make sure you have something in your stomach, not on an empty stomach, because then you can get some of that stomach upset. Usually, as long as you've got a decent snack or a meal on board and you take a gel cap, you're just fine. Some other topicals that we have in the summer, this has been popular. The roll-on from Ananda, it's the highest strength CBD roll-on that we have, and it has several other things in terms of essential oils, menthol, white willow bark. This is really nice because it's great for a lot of like muscle aches and pains, and you can just grab it and go. The salve is nice because it's a little bit thicker. It has more of a waxy base, and so I found that our patients really like this if they are trying to work something into smaller joints. So maybe their hands or their knuckles if they have arthritis, or knees, or just smaller spaces. And we can give you samples of this because it comes in a nice little container. So I can give you a little sample in a little container. And I think what seems like people like this the most for is hand and joint pain in the hand and arthritis. So that's been very popular. And we do have an intimate oil, Bliss. I've actually gotten good feedback on this, and it seems to, people are rebuying. So that to me says that people like it. So there are just a few of our products. If you have questions, if you're interested, we really encourage you to talk to the pharmacist. When you come into a pharmacy, especially your local pharmacy, we are not hidden in a back corner. We are not behind 3 layers of plexiglass. We're here and we are available, and we practice pharmacy that way because we want to talk to you. We want to talk to patients. And so your best bet when you come into the pharmacy, before you just grab something off the shelf and go your own way, when you're getting a new product, when you're trying to self-treat over the counter and getting something for the first time, talk to your pharmacist. We'll check for drug interactions. We'll check if that medication is the most appropriate for you, the most effective, if it's the safest option. And a lot of times it is a great medication and it's safe and it's going to work well, but we might have suggestions on something that is going to fit your lifestyle better, or is less expensive, or is from a more reputable company, or whatever pharmacy that you go to. Always feel free to ask your pharmacist, to talk to your pharmacist. That is what we are here for, and that's why we're in pharmacy.